Meet Pat McFadden. Pat retired in 2010, but he prides himself on staying busy.
Saturday morning, I'm either fishing, hunting, or working around the house.
These days, you can find Pat at the lake fighting for the biggest catch. It's almost hard to believe just 5 years ago he was fighting a much bigger battle.
This was a man who had been unfortunately diagnosed with metastatic cancer into his liver.
They call me a success story. And I feel like I dodged a bullet. I dodged a bullet because I got it early.
You can also call Pat the poster child for early detection. He asked the doctor to check him for cancer after he started having abdominal pain and diarrhea.
I just wanted to get checked out to make sure that I didn't have it.
These symptoms were a red flag. Pat's brother had experienced similar problems just before he was diagnosed with carcinoid cancer just 2 years earlier.
He's my hero. He's the one that told me what to look for. And I truly believe that he was part of my recovery for having this carcinoid cancer. Golden Gate Bridge.
But for Pat and his wife Shirley, the diagnosis was a bit of a deja vu. You see, the couple shares more than their love for travel. Both of them have beat cancer.
My wife, 20 years earlier, went through breast cancer. Okay, so we've already went through that part of it at one time. So it was kind of like going through the same thing again, telling our children.
I was mad and I was scared. I didn't want him to have to go through treatments. But once we found Dr. Boyd and Dr. Wang, I was much relieved.
Full of relief, Pat and Shirley chose to respond to the positive test results with a positive attitude. Then it was time to tell their family.
I laid it out to them in a positive way that I was going to beat this thing.
They could be positive because they knew that having the big C wasn't the end, which I think is very important for someone who's going through cancer.
Also important, a doctor you're comfortable with. And that's what Pat found in Dr. Eric Wang.
His quality of life was not good and had grown in size, and his treatment options were limited. He was not a surgical candidate.
That's because the carcinoid cancer had spread to Pat's liver. So instead of going under the knife, he was treated with direct radiation, using a relatively new form of treatment called spheres.
We're able to inject radioactive particles or something called chemoembolization, where we're injecting poison or cancer drugs directly to the tumor bed.
Spheres are so tiny they're smaller in width than a strand of hair. But they pack a powerful punch.
They're meant to kill off cancer cells, but if they are in the wrong location, they can also cause complications.
During the procedure, precision is key. The doctors at Charlotte Radiology use a lifetime X-ray to make sure the microbeads go directly into the tumor. Once they're in place, they radiate the tumor from the inside out. Pat says the procedure didn't really hurt. It's actually done as outpatient surgery. The only side effects he had were hot flashes and some nausea.
It was amazing how well I felt. I was in the hospital in the morning. I was released that evening.
Once Dr. Wang put the microspheres in place, they stayed in Pat's body for about 6 weeks. Spheres exit the body slowly, mainly through the patient's urine. After the spheres radiation, Pat did 3 rounds of chemo, each about a month apart, followed by an ablation treatment.
We're actually able to go directly into the tumor bed and burn the tumor using thermal ablation or microwave energy to kill off cancer cells. It's patients such as Pat that we've made a difference in their life that I really think that inspires us to continue to do what we do.
Dr. Wang and the staff at Charlotte Radiology work not just to prolong their patient's life, but to improve it.
He was symptom-free. It was as if he never had the cancer.
Pat says he's healthier now than he was before he was diagnosed with cancer. Dr. Wang says there's just one more thing Pat needs to come through with.
I haven't gone fishing with Pat yet, so.
Pat knows the importance of follow-up visits and still sees Dr. Wang each year for a CT scan. Pat has hit a big milestone, 5 years cancer-free.
That's a good picture there. Shirley's made a commitment to me that she's going to get me past my 90th birthday, so I'm really looking forward to a lot more years of being healthy and being able to travel.
For Carolina Impact, I'm Danielle Koser reporting.
This is a co-production of WTVI PBS Charlotte and Charlotte Radiology.